not bad at all.
Good. All right. So, chapter 2, page 26, medical asepsis and the OSHA standard. All right. So, let's see here. Alicia, can you go ahead and read the paragraph under the introduction to medical asepsis and the OSHA standard?
Okay. Medical asepsis and infection control are crucial in preventing the spread of disease. The medical assistant should always practice good medical aseptic techniques to provide a safe and healthy environment in the medical office. The Occupational Safety and Health Administration (OSHA) bloodborne pathogens standard is important for infection control. The standard is required by the federal government to reduce the exposure of healthcare employees to infectious diseases. This chapter presents a thorough discussion of asepsis, infection control, and the OSHA bloodborne pathogen standards.
All right, very good. Okay, so on this paragraph, the only thing that you need to highlight is where it says Occupational Safety and Health Administration, OSHA. All right. So microorganisms and medical asepsis. And you guys, so we're going to be coming across some really unique words in these chapters. And you're going to even notice that sometimes, even today, some of these words are a little difficult to pronounce. They're just, they're just a little different. So don't worry if you mispronounce a word or whatnot. We're going to work through it. All right, so microorganisms and medical asepsis. So Anastasia, can you go ahead and read the first paragraph under that, please?
Microorganisms are tiny living plants or animals that cannot be seen with the naked eye, but instead must be viewed with the aid of a microscope. Common types of microorganisms include bacteria, viruses, protozoa. How do you say that?
Protozoa.
Protozoa, fungi, and animal parasites. Most microorganisms are harmless and do not cause disease. They are termed non-pathogen,
Correct.
or other microorganisms known as pathogens are harmful to the body and can cause disease.
All right, thank you. So I need you guys to, the very first part of this, I want you to highlight where it says microorganisms are tiny living plants or animals that cannot be seen with the naked eye. You're also going to highlight the common types of microorganisms, including bacteria, viruses, protozoa, fungi, and animal parasites. You're going to highlight where it says harmless and do not cause disease. Highlight non-pathogens, and pathogens are harmful to the body and can cause disease. All right, Jasmine, can you go ahead and read the next paragraph, please?
Where it says in the
medical office.
In the medical office, practices must be employed to inhibit the growth and hinder the transmission of pathogenic microorganisms, to prevent the spread of infection. These practices are known as medical asepsis. Medical asepsis means that an object or area is clean and free from disease-producing microorganisms. Non-pathogens would still be present on a clean or medically aseptic object or surface, but all the pathogens would have been eliminated.
Very good. So you're going to want to highlight where it says medical asepsis and the meaning of medical asepsis. And then highlight the sentence where it says non-pathogens would still be present on a clean and medical aseptic object or surface. Growth requirements for microorganisms. Nancy, will you go ahead and read number 1 and number 2, please?
For microorganisms to survive, certain growth requirements must be present in the environment as follows. Proper nutrition. Microorganisms that use inorganic or non-living substance as source of food are known as autotrophies.
Mm-hmm.
Microorganisms that use organic or living substance for food are known as heterotrophies.
Mm-hmm. Very good.
Number 2, oxygen. Most microorganisms need oxygen to grow and multiply and are termed aerobes.
Aerobes.
Other microorganisms known as anaerobes
Mm-hmm.
grow best in the absence of oxygen.
Very good. I told you we're going to be coming around some doozy words. All right,
Very.
very good. So, Natalie, will you go ahead and read 3 and 4, please?
Temperature. Each microorganism has a temperature at which it grows best, known as the optimum growth temperature. Most organisms grow best at 98.6 degrees Fahrenheit, 37 degrees Celsius, the human body temperature. Darkness. Microorganisms grow best in darkness.
Very good. Thank you. All right, Talia, will you go and read 5 and 6?
Moisture. Microorganisms need moisture for cells, metabolism, and to carry away waste. 6. pH. The pH is the degree to which a solution is acid or basic. Most microorganism prefers a neutral pH. If the environment of the microorganism becomes too acid or too basic, they die.
Very
Do you ever
good.
finish it?
You can if you want. That's fine.
If the growth requirements are taken away from the environment of microorganisms, they are unable to survive. Elimination these conditions is one way to reduce the growth and transmission of pathogens in the medical office.
Very good. Thank you. Okay. So on this part, you're going to want to highlight each of these numbers. Basically 1, 2, 3, 4, and 5 and 6. So I want to take a moment and I want to look on page 27, the figure 2.1. So we basically have this little circle and this little diagram going just kind of like around the clock. So one, you have your reservoir host is one that becomes infected by the pathogen and also serves as a source of transfer of the pathogen. The host provides nourishment for a microorganism to grow and multiply. Example includes people and animals. And then number 2, means of exit from the reservoir host include the mouth, nose, throat, ears, eyes, intestinal tract, urinary tract, reproductive tract, and open wounds. Okay, so just with this right here, what is going on in the world right now that we could actually see this circle happening?
Coronavirus.
Exactly. Exactly. So, number 3, means of transmission from one person to another include direct contact with the infected person or discharge. Indirect transfer includes the transfer of microorganisms by droplets of moisture expelled from the upper respiratory tract, known as droplet infection, as when a person coughs or sneezes, contaminated hands and equipment, contaminated food and water, and insects that carry pathogens. So let's take coronavirus. And I know everybody's tired of hearing it, but this is an active example of how things work from a medical standpoint. So when we think of coronavirus, we just think that maybe someone sneezed within a certain range from another person, right? Okay, well, what about objects? So objects can still be contaminated with those droplets. Your shoes, your clothes, door handles, countertops, anything that that person came in contact with and then touched is now infected, right? So then that moves on to number 4, means of entry. Into the host include the mouth, nose, throat, ears, eyes, intestinal tract, reproductive tract, open wounds, and breaks in the skins and mucous membranes. Number 5, susceptible host is one who is capable of being affected by the pathogen. The resistance or the ability to fight off the disease of the host is low. Factors that contribute to low resistance and increased susceptibility include poor health, poor hygiene, poor nutrition, and stress. So with using that example, does that kind of make sense on what they're saying on that little graph there?
Yes.
Okay, very good. So at this point, does anybody have any questions? No? Okay. So now we kind of get an understanding of medical asepsis and the OSHA standards. So medical asepsis, it's going to break down the process on how pathogens, whether they're good or bad, stand on surfaces in people and break in through the skin and droplets, and what we have to do as a medical assistant to control the environment, right? So that's what this chapter is going to kind of break down. All right, infection process cycle. Infection is the condition in which the body or part of it is invaded by a pathogen. For a pathogen to survive and produce disease, a continuous cycle must be followed. This is known as the infection process cycle, that figure that we just went over. If the cycle is broken at any point, the pathogen dies. The medical assistant has a responsibility to help break this cycle in the medical office by practicing good techniques of medical asepsis. These techniques are discussed in the next section. So now we have protective mechanisms of the body. The body has protective mechanisms to help prevent the entrance of pathogens, and these help break the infection process cycle. Protective mechanisms of the body are as follows, page 28. Alicia, can you go ahead and read number 1, please?
The skin is the body's most important defense mechanism. It serves as a protective barrier against the entrance of microorganisms.
Very good. Anastasia, can you go ahead and read number 2?
Mucus and saliva in the nose and respiratory tract fights off pathogens. Mucus traps the smaller microorganisms that enter the body, and the hair-like. How do you say that?
Celia.
Okay, hair-like cilia constantly beats towards the outside to remove them from the body.
Awesome, thank you. Jasmine, can you go ahead and read number 4 and 5?
Coughing and sneezing help force pathogens from the body. Tears and sweat are secretions that aid in the removal of pathogens from the body.
Very good. Nancy, will you read number 6 and number 7, please?
Urine and vaginal secretions are acidic.
Acidic.
Acidic. Pathogens cannot grow in the acidic environment. The stomach secretes hydrochloric acid, which helps in the process of digestion. This acidic environment discourages the growth of pathogens that enter the stomach.
Very good. Okay. So let's go back to page 27. I want you to highlight number 3 and number 5 on that figure 2.1. And then on page 28, you're going to highlight 3, 4, 6, and 7.
Number 3 and 4 on the little diagram thing?
3 and 5 on that little
5, okay.
diagram.
Okay.
And then 3, 4, 6, and 7 on the cycle on page 28. All right, medical asepsis in the medical office. Hand hygiene. All right. Ba-dum-bum-bum-bum-bum-bum. Talia, can you go ahead and read the first paragraph for me?
Hand hygiene refers to the process of cleansing of sanitizing the hands. Hand hygiene is considered the most important medical aspect practice in the medical office for preventing the spread of infection. Specific techniques for sanitizing the hand is in the medical office, including the following: hand washing with plain soap and water, hand washing with how you say that?
Antimicrobial soap.
Antimicrobial soap and water, applying the alcohol-based hand rub.
Very good. Thank you. Okay. So I only want you to highlight where it says hand hygiene refers to the process of cleansing or sanitizing the hands. Hand hygiene is considered the most important medical aseptic practice in the medical office. Now, when you guys go to, even when you go to the clinic, when you go to your extern office and your future employment offices, you're going to see one, if not all three of these items in your office. You're going to see just soap next to your sink, whether it's in the patient room or in your lab or at the nurse's station. You'll see a antimicrobial soap, and you may also see a alcohol-based hand rub, or what we like to call a hand sanitizer. So you may see all three of these things in your facility. All right, Natalie, will you go ahead and read the next paragraph, please?
Where it says the Centers of Disease Control.
Yes, ma'am.
The Centers for Disease Control and Prevention, CDC, provides recommendations for hand hygiene in healthcare settings. The purpose of these guidelines is to promote improved hand hygiene practices and to reduce transmission of pathogenic microorganisms to patients and employees in healthcare settings. The CDC guidelines for hand hygiene as they apply to the medical office are outlined in box 2.1. They're also discussed further in this section.
Thank you. All right. So really quickly, we're going to take a little quick break for just a moment. So if you guys need to refresh your coffee or whatnot, you go right on ahead. And then we'll get started on the resident and transient flora. Okay, so resident and transient flora. Let's see. Alicia, will you go ahead and read the first paragraph, please?
Microorganisms on the hands are classified into the following categories: resident flora and transient flora. Resident flora, also known as the normal flora, normally resides and grows in the epidermis and deeper layers of the skin known as the dermis. Resident flora is usually harmless and non-pathogenic because resident flora is attached to the deeper skin layers. It is difficult to remove from the skin.
Awesome, thank you. Anastasia, can you go ahead and read the next paragraph?
Transient flora lives and grows on the superficial skin layers and epidermal, and it is picked up on the hands during the course of daily activities. In the medical office, this may include contact with an infected patient, contaminated equipment, or contaminated surface. Transient fluoride is often pathogen, but because it is attached loosely to the skin, it can be removed easily with proper hand washing or applying an alcohol-based hand rub.
Awesome, thank you. Okay, so the only thing you guys need to highlight is transient flora lives and grows on the superficial skin layers or the epidermis. It is picked up on the hands during the course of daily activities. All right. Jasmine, can you go ahead and read the first paragraph on page 29 under hand washing?
Hand washing refers to the washing. Oh, wait. Hand washing refers to washing the hands with plain, non-microbial soap and water. Plain soap contains agents that help break down and emulsify dirt and oil present on the skin. Soap is used to sanitize the hands through the physical removal of dirt and transient flora. It is important to use adequate friction during hand washing to ensure the removal of all transient flora. The CDC recommends that the hands be rubbed together vigorously for at least 15 seconds, making sure to cover all surfaces and to focus on the fingertips and fingernails. Procedure 2.1 outlines the hand washing procedure.
Awesome, thank you. Okay, so you only want to highlight where it says the CDC recommends the hands be rubbed together vigorously for at least 15 seconds. So what is something that we can sing to ourselves? What are a couple ideas that we could sing to ourselves while we are applying the soap and we're rubbing our hands back together, causing friction, the wrist in between the nails? That
Happy birthday.
Happy birthday.
happy birthday. Yep. What's another one?
I don't know the I love you song.
Yes. Good old Barney. Yep.
Yes.
Yep. What's another one?
Mm,
You could do the ABCs. You could sing them, 2 or 3 times. If you're really cool, you'll sing them backwards. I'm not going to try to do that. You really could think of anything, any song, or even if you're like me and you get songs stuck in your head, go ahead and just keep singing it to yourself a few times, and then the next thing you know, you've wasted 15 to 20 seconds easily, right? It's not that big of a deal. But you'll be surprised, especially now that you start doing that when you're washing your hands and when you're in your medical office, you'll be surprised at how many people aren't washing their hands correctly. All right, very good. So who would like to read that next paragraph?
are we under the CDC?
Yes.
Okay. The CDC hand hygiene guidelines recommend that hand washing be performed when the hands are visibly soiled with the dirt or body fluids before eating and after using the restroom. See box 2.1. If the hands are not visibly soiled, the CDC recommends that an alcohol-based hand rub, rather than in hand washing, be used to sanitize the hands. This is because repeated hand washing tends to dry out the hands, leading to irritation, chapping, and dermatitis.
Very good. Okay, so you're only going to want to highlight that very first sentence. So is the CDC saying that, oh, well, we can just use hand sanitizer all the time?
No.
No. They're saying that you do not have to wash your hands all the time. You can use this option, especially if we know that the hands are visibly soiled. Now, when you are washing, it is good to use warm water. However, if you're using super hot water and you are washing your hands several times a day, it really does dry your skin out, and it can be very uncomfortable. So, if you are one that does like to wash their hands a lot, that's not a problem at all. Maybe carry like a little some of the gentle cleansers that you can use so it's not so harsh on your hands. All right, antiseptic hand washing. Natalie, will you go ahead and read the first paragraph, please?
Washing the hands. Yeah. Okay. Washing the hands with an antimicrobial soap is termed antiseptic hand washing. Antimicrobial soap contains an antiseptic, which is an agent that functions to kill or inhibit the growth of microorganisms. 2.2a. Antiseptic hand washing sanitizes the hands through the mechanical scrubbing action and through the action of the antiseptic. Proper hand washing with an antimicrobial soap removes all soil and transit flora from the hands. Most antimicrobial soaps also deposit an antibacterial film on the skin that discourages bacterial growth. Antiseptic hand washing should be performed by the medical assistant before assisting with minor office surgery. Examples of antiseptics contained in antimicrobial soaps include triclosan, chlorhexidine, hexachlorophene, iodine, and chloroxylenol.
Yeah, those are some tough words. Yes, so you will see in your medical office. Has anyone heard of the word Hibiclens? Maybe not.
No.
So Hibiclens, it's almost like a pink. It's a pink red soap that you will see in your offices, especially in your procedure rooms. That this is a really good um, antimicrobial soap that you even the surgeons use before they do open surgery. Okay. You can wash your hands with these, you can wash the skin with these. The problem is that if you use this one particular soap all the time, you will literally cause cracks in your skin. It dries it out so bad.
Is that the same soap that they usually give out when they're going to do a C-section on a woman?
Yes, ma'am. Yes,
Okay.
ma'am. It is the same thing. So if you look up the word Hibiclens, you're going to see Hibiclens and then you're going to see this other little funky word, right? So let me go to our awesome Google here and I'll show you what I mean. All right, so the brand name is Hibiclens. The generic name is chlorhexidine. Well, we just read that chlorhexidine is an antiseptic. So you'll see these terms once you start getting out in the field. And probably now that you're studying about them, you'll probably see them more often than you realize. But that is a really frequent wash that you will see in your office. The other common one is the iodine. Okay. So if you don't know, iodine is a really good cleanser. The only problem is it can kind of stain your skin, right? Especially if you've had a procedure done and they used iodine to clean the skin, you have like this yellow tint to your skin. So that is another option. Now, the problem is that you can only use iodine in certain parts of the body, and you can only use chlorhexidine on certain parts of the body. So you will actually probably see both of these items in your office. All right, alcohol-based hand rubs. Talia, will you go ahead and read the first paragraph, please?
CDC guidelines recommend the use of alcohol-based hand rubs for sanitizing the hands when they are not visibly soiled. Alcohol-based hand rubs, also known as alcohol. Okay, hold on.
Okay.
Alcohol-based hand rubs, also known as alcohol-based hand sanitizer, consists of 60% to 90% of alcohol, ethyl, or is what's that?
Isopropanol.
Isopropyl. It comes into the form of gel, lotion, and forms. Studies have shown that the hand rubs are more efficient than traditional hand soap and water. Hand soap and water hand washing is removing transient flora and reduced bacteria count on the hands. The advantages that alcohol-based hand rubs are often traditional hand washing are as follows. Alcohol-based hand rubs are usually more accessible than sinks. They do not require rinsing, therefore water and hand drying with a towel are not needed. Less time is required to perform hand hygiene. It takes approximately 30 seconds to sanitize the hand with an alcohol-based hand rub, compared with 1 to 2 minutes to perform proper hand washing. They are less damaging to the skin, resulting in less dryness and irritation. Most alcohol hand rubs contain, what's that?
Emollients.
emollients, which help prevent the skin of the hands from overdrying. As the alcohol dries, protect fats and oil remains on the hand.
Very good. Thank you. Okay, so I want you guys to highlight the very first sentence where it says the CDC guidelines recommend the use of an alcohol-based hand rub for sanitizing the hands when they are not visibly soiled. And then I want you to highlight where it says the advantages of the alcohol-based hand rubs offer over traditional hand washing are as follows, and you're going to highlight each of those bullet points. Alcohol-based hand rubs have disadvantages. They are more expensive than plain soap. They also can cause a brief stinging sensation if they are applied to a broken skin, such as a cut or an abrasion on the hand. Procedure 2.2 describes the proper steps for performing an alcohol-based hand rub. And that is no lie. You will never know if you have a paper cut on your hand until you use hand sanitizer. It finds it. And you're like, ooh, ouch. All right, infection control. Does anybody have any questions about anything so far? All right. Alicia, can you go ahead and start reading infection control? If you will also read 1, 2, and 3, please.
Okay. In addition to hand hygiene, other good aseptic practices in the medical office include the following. Number 1, follow the OSHA bloodborne pathogen standard presented in this chapter. Number 2, keep the medical office free of dirt and dust, which can collect and carry microorganisms. Number 3, ensure that the reception area and examining rooms are well ventilated. Stuffy rooms encourage microorganisms to settle on objects. You said 4 till 4, right?
No, you can stop at 3.
3? Okay.
Anastasia, will you go ahead and read number 4, 5, please?
Keep the registration area and examining rooms bright and airy. Light discourages the growth of micropathogens, eliminates the insects by the use of insecticide or window screens. Insects are a means of transmissions of microorganisms.
Very good. All right. Jasmine, will you read 6, 7, and 8?
Carefully dispose of waste such as urine, feces, and respiratory secretions. All waste should be handled as though they contain pathogens. Do not let soiled items touch clothing. Avoid coughs and sneezes of patients. Moisture droplets expelled from the lungs with coughing and sneezing may contain pathogens.
Awesome. Very good. Nancy, will you go ahead and read number 9 and 10?
Use discretion in the amount of jewelry worn. Wear minimal jewelry or no jewelry at all. Microorganisms can become lodged in the grooves and crevices
Uh-huh.
of jewelry and serve as means of transmission of pathogens. Teach patients aseptic practices to control the spread of infection at home.
Very good. Okay. So you're going to want to highlight number 2, number 6, number 8, and number 9. So my future medical assistant. So is it okay to wear some jewelry? Yes, it is. You will always see me wear anywhere from 2 to 3 items, and that's it. Small looped earrings. You will not see me wear a size bigger than this. What would be a reason that I'm not going to wear really big looped or big dangly earrings?
It can get in the way.
It can. It can. What's another thing that it could cause? Does anybody have an idea?
An infection?
It can. So if we're working with babies and they see something dangly and shiny, what do you think they're going to grab? They're going to grab that earring, and it's going to hurt. So the other thing is you'll see me wear my wedding ring. Now, I make sure that I carry my supplies with me when I go to my job to make sure that I have access to clean my rings and if I have my nails done. So that would be another option that you may want to do, whether if it's just a toothbrush or a little like a dish brush, just something that you can clean your ring and your nails underneath your nails if you need to. A cuticle, you may see that in your office if you need to clean under your nails. But you will not see me wear anything more than that on my hands as far as rings. And that's because it can carry microorganisms. It's a place for germs. So the more you have, the more you may be apt to have these germs start embedded. The other thing you'll see is you may see me wear my smartwatch. But again, I make sure that my smartwatch can obtain some water because guess what I do a lot? I wash my hands a lot. So keep those items in mind when we start going to the clinic and when you start on your externship site. Any questions about that?
No.
All right. Very good. Natalie, will you go ahead and read the first paragraph under gloves, please?
Gloves reduce hand contamination by 70% to 80%. Reduce cross-contamination between patients and protect patients and healthcare workers from infection. The CDC recommends that clean disposable gloves be worn when the medical assistant is likely to come in contact with any body substance, such as blood, urine, feces, mucous membranes, and non-intact skin. Clean disposable gloves should be worn when administering an injection, performing a venipuncture, or performing a urine analysis. Clean disposable gloves come in the following sizes: small, medium, large, and extra large, and sometimes extra small. Procedure 2.3 presents the proper method for applying and removing clean disposable gloves. Sterile gloves are used to perform sterile procedures such as dressing change or to assist the provider during minor office surgery, which is described in greater detail in Chapter 10.
Yes, one of my favorite chapters. Okay, very good. So, in the little baggie that each of you got, you do have a pair of your clean disposable gloves. Now, it is a large that's in there. But once we get to the clinic, so one thing that you can go ahead and do is you can try on those gloves, right? So I'm going to go and grab my little baggie because I actually have it here with me. Okay. Now, one thing you can do with the gloves is you can go and put these gloves on and we can see, well, is this size going to fit, right? Because you may never have worn clean disposable gloves. All right, so I'm putting on, again, these are the large. So I'm putting on the large. Okay, now for me, see, I don't know if y'all can see, but it's kind of big, right? So I know that large is not going to be my size. Okay, now being a medical assistant for 20 years, I know that I can actually wear a medium in most cases and even a small. But that's a good way for you to go ahead and try on the gloves. And you can even see, well, is that a good size for you? Do you know that those are big and you know that you'll need a smaller size whenever we get to the clinic? All right, types of gloves. Talia, can you go ahead and read types of gloves, please?
There are two general types of gloves, non-latex and latex. Non-latex gloves are made from synthetic rubber. Examples of non-latex gloves include nitrile, VNE, and polychlorinated. What's that?
Polychloroprene or neoprene gloves.
Latex gloves are made from natural rubber latex, which is milky liquid that is extracted from rubber trees. The primary disadvantage of latex gloves is that they can use an allergic reaction in individuals with hypersensitivity to latex. The mild allergic reaction causes the following symptoms: redness of skin, urticaria, hives, and
Urticaria.
itching.
Yeah. So you'll see this word a lot. Urticaria, which is also is the medical term for hives.
A more severe allergic reaction causes sneezing, itchiness, red eyes, runny nose, asthma symptoms, shortness of breath, coughing and wheezing. Symptoms typically begins with minutes after contact with the latex because of the most healthcare workers now use non-latex gloves when performing clinical procedures.
Very good. Okay, so the only thing I need you guys to highlight is where it says a mild allergic reaction causes the following symptoms: redness of skin, urticaria, hives, and itching. Now, the gloves that you guys have in your baggie, those are non-latex. Most offices do not carry latex products anymore just because there are so many people that have a sensitivity to latex. Now, if you've ever seen maybe a provider take off a pair of gloves and their hands are powdery underneath, that is latex. So it always leaves this white substance behind on your hands. A lot of sterile gloves that are still used, some of them are still have that powdery, it's that latex, but most of the time now most all products now are considered latex free. All right, any questions about that? Nope. Okay. So now we're going to start with glove guidelines. The medical assistant should adhere to the following glove guidelines. Alicia, can you go ahead and read 1, 2, and 3 for me?
Number 1, nails trimmed short, less than 1/4 of an inch long, to reduce the risk of tearing the gloves during application and use. Number 2, wear the correct size glove. Gloves that are small may rip as they are applied or may become uncomfortable to wear. Gloves that are too large may make it difficult to perform tasks. Number 3, do not store gloves in an area where there are extremes in temperatures, example near a heater or an air conditioner. These conditions can cause deterioration in the gloves.
Awesome, very good. So you guys are going to want to highlight number 1, 2, and 3. All right. So far we see on page 28, there's a box 2.1, the CDC guidelines for hand hygiene in healthcare settings. And then on page 30, your procedure 2.1 on hand washing. Now, I want you guys to make sure, like we discussed in the last chapter, it is very important that you read these little boxes inside the chapters. It's going to tell you how to do these procedures, like step by step. So they're really good for you to read over. Okay, so now let's go on over to page 35. And does anybody have any questions about anything so far? All right. Anastasia, on page 35 for the OSHA bloodborne pathogens standard, if you will go ahead and read just that first paragraph under purpose of the standard.
The federal government established OSHA to assist employers in providing a safe and healthy working environment for employees. To provide a safe working environment for healthcare workers, OSHA developed a comprehensive set of regulations known as the OSHA Occupational Exposure to Bloodborne Pathogen Standards. These regulations are designed to reduce the risk to employers of exposure to infection diseases.
Very good. So you guys are going to want to highlight the very first part where it says OSHA, Occupational Safety and Health Administration. And then the very last sentence where these regulations are designed to reduce the risk to employees of exposure to infectious diseases. Jasmine, can you go ahead and read the next paragraph, please?
The OSHA blood pathogen standard must be followed by any employee with occupational exposure to pathogens, regardless of the place of employment. In addition to medical assistants, employees with occupational exposure include providers, nurses, dentists, dental hygienists, medical laboratory personnel, and emergency medical technicians. Employees who may have less occupational Employees who may have less obvious occupational exposure are correctional and law enforcement officers, firefighters, hospital laundry workers, morticians, and custodians.
Very good. Failure by employers to comply with the OSHA standard could result in a citation carrying a maximum penalty of $7,000 for each violation and a maximum penalty of $70,000 for repeat violations. So you guys, on that second paragraph, you're going to want to highlight where it says the providers, nurses, dentists, dental hygienists, medical laboratory personnel, and emergency medical technician, and highlight correctional and law enforcement. All right, so now we have our first case study for chapter 2. So case study number 1, Petra Meyer has come in for her annual.
Sorry, what did you highlight?
You're going to highlight where it says on that second paragraph, providers, nurses, dentists, dental hygienist, medical laboratory personnel, and emergency medical technician, and highlight correctional and law enforcement. All right, case study number 1. Petra Meyer has come in for her annual gynecologic examination. Because Petra has been feeling tired and run down, the provider orders blood to be drawn for a complete blood count, the CBC, and a comprehensive blood chemistry profile. Petra indicates that she wears rubber latex glove when house cleaning to protect her hands from the chemicals in the cleaning solution. Petra says that the last 2 times she's cleaned her house, she experienced redness and itching of her hands, along with a runny nose and red, itchy eyes. She wants to know if this might be caused by breathing in the cleaning solution or getting some of it on her hands after taking off her gloves. Petra says she's also experienced redness and itching on her feet the last time she wore rubber flip-flops. All right, so the first part of this is what would you do? So, what would we do for Miss Petra?
Can you run an allergy test on here?
You could. Would that be something that we would do or the doctor would do?
The doctor.
Okay, very good. All right, that's good. All right, so what's something else that we could do?
What did she say?
The doctor can order allergy testing.
Oh, okay.
Anybody else have any ideas on what she could do? As Petra's medical assistant, what would we need to do after hearing her say some things?
We need to refer her to somewhere else because she's at her gynecology appointment, and right?
Once you change different products and stop using the same kind.
She could. So the first thing that we would want to make sure that we're doing is we're documenting her symptoms, right? And it could, so as a medical assistant, you're probably thinking, you know what, she's probably allergic to the chemical, right? But we're not the doctor. So what would be something that we could advise Petra that,
And some people are just allergic to latex.
right? So she could be allergic to latex, but we're the medical assistant, we're not the provider. So as the patient's medical assistant, what's some things that we might want to tell the patient?
When the doctor comes in, to make sure she brings it to the doctor's attention.
Very good. That's right. So we're going to notate what the patient is saying. And even if she is seeing her gynecologic doctor, that's okay. He's still a doctor and he can provide her with that information on either what she can do or maybe who she needs to see to follow up on those concerns if it's something that he doesn't want to personally handle. Very good. Okay, so now let's flip it. What would you not do?
Not tell her that she's allergic to latex.
That's right. So, I mean, we could say, I mean, it could be, but we're not the doctor and we can't diagnose.
Correct.
But so that's correct. So we wouldn't tell her that, oh, well, just stop using latex. That's what it is. Because we've not had that, we don't have the doctor credentials by our last name. So we can't diagnose the patient. Now, you will see as medical assistants, the longer that you're in the field, you are going to be picking up on a lot of stuff that you're going to know what's wrong with the patient. But even if you are right, we're still not going to tell the patient because we are not the doctor.
Correct.
But you will find, especially in some of the specialty fields, that, even when I was at, say, dermatology or even general surgery, I worked with my doctor so much that he would ask me, well, what do you think? I'd be like, well, I think it could be the gallbladder. And he's like, yeah, that's right. So you will find that you are going to be able to really have those awesome discussion with your doctors, but we are not the doctor. So we never want to actually personally advise the patient, oh, it's just an allergy. Just stop using that product. All right, very good. All right, OSHA terminology. The following definitions help clarify terms related to OSHA bloodborne pathogen standard. Nancy, will you read occupational exposure?
Occupational exposure is reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potential infectious materials that may result from the performance of an employee's duties.
Very good. Natalie, will you read sharps?
Sharps are objects that can penetrate the skin, including but not limited to needles, lancets, scalpels, broken glass, and glass capillary tubes.
Very good. Talia, will you read parenterial?
Parenteral refers to the piercing of the skin barrier or mucous membrane, such as through needle sticks, human bites, cuts, and abrasions.
Very good. Alicia, will you go ahead and read blood?
Blood means human blood. Human blood components and products made from blood. Blood components include plasma, serum, platelets, and serosyn. I'm not even gonna try. How do you even say that?
Serosanguinous fluid.
Okay. Fluid. An example of the blood product is a medication derived from the blood, such as immune goblin. When I'm reading it, I want to say goblins, even though I know it's not that, but it sounds like it.
So yeah, I know. So
Globulins? Globulins?
Yes.
Okay.
Yes. I told you
Goodness.
guys we're gonna be coming across some doozies. All right, very good. Anastasia, will you go ahead and read bloodborne pathogens?
Bloodborne pathogens are path, uh, pathogenic microorganisms and human blood that can cause disease in humans. Bloodborne pathogens include but are not limited to hepatitis B, hepatitis B virus (HBV), hepatitis C virus (HCV), and human intradeficiency virus (HIV). Other potentially infectious materials. Uh, O, OPIM included the following: serum and vaginal secretions, cerebral,
Cerebral spinal.
cerebral spinal synovial
Synovial.
and perular, and these words are really hard.
I know, guys. You are doing great though. So we've got pleural and pericardial.
Pleural and pericardial and per and
Toneal. Yep.
pineal and amniotic fluid.
Yes. Very good. Okay. So we're going to take a little quick break. So on our, not continue, we're going to stop for a second. Okay, so I want you guys to highlight sharps, bloodborne pathogens, and under other potential infectious materials, you're going to highlight the first 3 bullet points. All right, so Jasmine, can you go ahead and read? It'll be the start of the 3rd bullet point. If you'll read the following bullet points.
Any body fluid that is visibly contaminated with blood, any body fluid that has not been identified, saliva and dental procedures, any unfixed human tissue, any tissue culture, cells, or fluid known to be HIV infected.
Very good. Nancy, will you go ahead and read contaminated?
Contaminated is defined as the presence or reasonably anticipated presence of blood or opium on an item or surface.
Very good. Natalie, go ahead and read decontamination.
Decontamination is the use of physical or chemical means to remove, inactivate, and destroy pathogens on a surface or item to the point where they are no longer capable of transmitting infectious particles and the surface or item is rendered safe for handling, use, or disposal.
Very good. Talia, can you go ahead and read non-intact skin?
Non-intact skin that has a break in the surface. Non-intact skin is skin that has a break in the surface. It includes, but is not limited to, skin with dermatitis, abrasions, cuts, burns, hangnails, chapping, and acne.
Very good. Alicia, will you go ahead and read exposure incident?
An exposure incident is defined as a specific eye, nose, mouth, or other mucous membrane, non-intact skin, and parenteral, parenteral contact with blood or OPIM that results from an employee's duties.
All right, guys, very good. So now you're going to want to highlight non-intact skin and exposure incident. So being a medical assistant, you may come in contact with not one or all of these items. Okay, so if you are, once we start getting into the lab, you're going to see where I strive on nobody has an incident. So an incident is defined as a specific eye, nose, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or opium that it results in employee's duties. So that means if you get stuck with a needle, if you get cut with a sharp, a scalpel, a capillary glass tube, anything that can cause a break in the skin that has been contaminated, which means if it has gone into somebody else and you've stuck yourself, you now have an exposure incident. So this is everything that you have to be aware of your surroundings at all times. But with our patients, we are going to come in contact with our patients that are sick, whether it's a cold or they're HIV positive or they have hepatitis C. You're going to come in contact with all this. So it's your job to keep yourself aware of your surroundings. Does anybody have any questions about that?
No.
Okay. So OSHA is one big one that you will be required to do training at least once every year. So it's a really, really big one that we have to deal with as a medical assistant. All right. Anastasia, will you go ahead and read the components of the OSHA standard, just that first paragraph?
The OSHA bloodborne pathogen standard is present in the following pages as it is pertained to the medical office and includes the following categories: exposures, control plans, labeling requirements, communication of hazards to employees, and record keeping.
Very good. Exposure control plan. Jasmine, will you go ahead and read just the first paragraph?
The OSHA standard requires that the medical office develop an exposure control plan. The ECP is a written document stipulating the protective measures that must be followed in that medical office to eliminate or minimize employee exposure to bloodborne pathogens and OPIN. The ECP must be made available for review by all medical office staff. The ECP must include the following elements.
Very good. Nancy, will you read number 1, please?
An exposure determination. The purpose of this section of ECP is to identify employees who must receive training, protective equipment, hepatitis vaccination, and other protections required by the OSHA bloodborne pathogen standard. The exposure determination must include 1. A list of all job classifications in which all employees are likely to have occupational exposure, such as providers, medical assistants, and laboratory technicians. And 2. A list of job classification in which only some employees have occupational exposure, such as custodians. For the second classification of jobs, the determination must include a list of tasks in which occupational exposure may occur, such as emptying the trash.
Very good. Natalie, will you go ahead and read number 2, please?
The method of compliance. The method of compliance section of the ECP must document the specific health and safety control measures that are taken in the medical office to eliminate or minimize the risk of occupational exposure. These measures are extremely important in reducing the risk of infectious diseases for the medical assistant and are discussed in greater detail later in this section. See the section control measures.
Very good. Talia, will you go ahead and read number 3?
Post-tech closure evaluations and follow-up procedures. Post-tech exposure evaluation and follow-up must specify the procedure to following in the event of exposure incident into the medical office, including the method of documenting and investigating exposure incidents in the post-exposure evaluation, medical treatment, and follow-up that will be made available to the employee. See the box OSHA post-texture closure evaluation and follow-up procedures.
Very good. OSHA requires employers to review and update their ECP at least annually to ensure that the plan remains current with the latest information on eliminating or reducing exposure to bloodborne pathogens. The ECP also must be updated whenever necessary to reflect new or modified tasks and procedures that affect occupational exposure. I only need you guys to highlight where it says OSHA requires employers to review and update their ECP at least annually to ensure that the plan remains current with the latest information on eliminating, reducing exposure to bloodborne pathogens. All right, labeling requirements. The OSHA bloodborne pathogen standards requires that containers and appliances containing biohazardous materials also be labeled with a biohazard warning label. The biohazard warning label must be fluorescent orange or orange red and must contain the biohazard symbol and the word biohazard in a contrasting color. Figure 2.5a tells us all about it. A warning label must be attached to the following: containers of regulated waste, refrigerators and freezers used to store blood and OPIM, and 3, containers and bags used to store, transport, or ship blood or OPIM. I only want you to highlight 1, 2, 3 in that sentence. Red bags or red containers must be substituted for biohazard warning labels. The labeling requirement is designed to alert employees to possible exposure, particularly in situations with which the nature of the material or contents is not readily identifiable as blood or OPIM. Communicating hazards to employees. Alicia, will you go ahead and read the first and second paragraph, please?
Record keeping? Or which one?
On communicating hazards to employees.
Okay. You said the first one or the second one? The second one.
Read both of those paragraphs.
Okay. According to the OSHA standard, employers must ensure that all the medical office employees with a risk of occupational exposure participate in a training program. This program must present the ECP for the medical office while focusing on the measures that employees are to take for their safety. Training must be provided at the time an employee is initially assigned to the tasks in which occupational exposure may occur and at least annually thereafter. The employer must maintain records of the training sessions, which must include presentation dates, content of the sessions, names and qualifications of the trainers, and names and job titles of employees who attend. These records must be maintained for 3 years from the date of the training session.
Very good. Okay, so when you start in your extern office, you may see some of your employees are they're your OSHA certified, they're your OSHA go-to people. In I think honestly, in probably most of my offices that I worked, that was what I did. I maintained the OSHA aspect. I made sure that all of my fellow employees, that everybody is on the same page with knowing OSHA, knowing where to find the information, making sure everybody knew what to do in case of an incident, things like that. So that is an opportunity that if you do get that opportunity, I do highly recommend it. It is, it looks really good on your resume, but it's really good to make sure that you are aware of all the OSHA guidelines. All right, any questions about anything so far? All right, very good. Anastasia, will you go ahead and read under record keeping number 1?
The OSHA bloodborne packaging standards require that the following records be maintained. The OSHA medical records. The OSHA standards requires that the employer maintain an accurate OSHA record of every medical office employee at risk for occupational exposure. These records must be kept confidential except for review by OSHA officials and as required by law. The record must include the following employer's name, social security number, hepatitis B vaccination status, including dates of vaccination, results of any post-exposure examination, medical testing, and follow-up procedures, and a written evaluation of any exposure incidents along with a copy of an exposure incident report. The employer is required to maintain records for the duration of the the employment plus 30 years.
Very good. All right, Jasmine, will you read number 2, please?
Sharps injury log. Employers with more than 10 employees at risk for occupational exposure are required to maintain a log of injuries from contaminated sharps. The log must be maintained in a way that protects the confidentiality of injured employees. Example, removal of personal identification. The purpose of the log is to help employers and employees keep track of all needle stick injuries. This tracking helps in identifying problem areas that need attention and ineffective devices that need to be replaced. The Sharps injury log must contain the following information: type and brand of device involved in the injury, location of the incident, and explanation of how the incident occurred.
Very good. All right, Nancy, will you read control measures, please?
Specific health and safety control measures are required by OSHA to eliminate or minimize the risk of occupational exposure in the medical field. These measures are divided into 5 categories: engineering control, work practice controls, personal protective equipment, housekeeping, and hepatitis B vaccination.
Very good. Natalie, will you please read engineering controls?
The medical office must use engineering controls to eliminate or minimize the risk of occupational exposure. Engineering controls include all measures and devices that isolate or remove the bloodborne pathogens hazard from the workplace. Engineering controls must be examined and maintained or replaced as required to ensure their effectiveness. Examples of engineering controls are the following: readily accessible hand washing facilities, safe medical devices, biohazard sharp containers, and biohazard bags, autoclaves.
Very good. Okay, I want you guys to highlight where it says engineering controlled includes all measures and devices that isolate or remove the bloodborne pathogen hazards from the workplace. All right, safer medical devices. Talia, will you just read that first paragraph, please?
Can you tell me one more time what we were highlighting? I'm trying to find it.
That's okay. So under the engineering controls, it's
Okay.
that second sentence.
Okay, thank you.
You're welcome. All right, Talia, can you hear me?
Yes. You want me to finish it?
Go ahead and just read that first paragraph under safer medical devices.
Okay, safer medical devices are one example of engineering controls. A safer medical device is a device that's based on reasonable judgment would make an exposure incident involving containment sharp less likely. Reasonable judgment refers to the judgment of the healthcare worker who would be using the device.
Very good. I only want you guys to highlight that second sentence, please. All right, Alicia, will you read the second paragraph, please?
Starting at safer medical devices, right?
Yes, just the
Okay.
second paragraph.
Okay. Safer medical devices include sharps with engineered sharps injury protection and needleless systems. A sharp with engineered sharps injury protection (SESIP)
Mhm.
is a non-needle sharp or a needle device with a built-in safety feature used for procedures that involve the risk of sharps injuries. Examples of SESIPs, is that how you say it? Would you say it all the way? SESIPs
You could
or
do sepsis
SESIPs?
or the SESIPs.
Okay. Include safety engineered syringes and phlebotomy devices.
All right, so it says figure 2.6. So let's look at figure 2.6 really quickly. So A and B are safety engineered syringes. And then C is a safety engineered phlebotomy device. We do have these items in our clinic, okay? Now, when we get to the clinic and we start using our syringes and our needles and our phlebotomy devices, I'm not going to train you on using the safety. I'm going to train you on not using the safety. Because the way I see it is if I can train you on how to use the device, the non-safety device properly, then anything else will kind of just follow a little easier. Not all offices carry the safety devices. So you need to make sure you know how to use the non-safety devices. Okay?
That's what I was.
Yep. So we do have access to this at the clinic, but I'm not going to train you on that because you need to know how to be trained on the non-safety. Okay. All right. So let's see. Anastasia, can you please read the next paragraph, please?
A needleless system is a device that does not use a needle for the administration of medication or other fluids. 2, the collection of a or withdrawal of fluids after initial access to a vein or artery has been established, or 3, any exposure involving the potential of an occupational exposure to the bloodline. Okay, I should move. Pathogens has a result of punctures injuries from a contaminated sharp. For an example of a needleless system is a jet injection syringe, which uses comprehension or rather to administer the injection. I'm sorry.
You're fine. No worries. Not a problem at all. All right, good deal. Jasmine, can you go ahead and read that next paragraph, please?
Employers are required to evaluate and implement commercially available safer medical devices and other engineering controls that eliminate occupational exposure to the lowest extent feasible. Input from employees involved in direct patient care must be taken into consideration in making this determination. This helps to ensure that the individuals who are using the devices have the opportunity for input. As part of the annual review of the ECP, the following information must be documented: that safer medical devices that reflect changes in technology are being evaluated and implemented in the workplace, and that input was obtained from employees in selecting safer medical devices.
Very good. All right. Nancy, will you go ahead and read work practice controls? If you will read the first paragraph and number 1.
Work practice controls reduce the likelihood of exposure by altering the manner in which the technique is performed. It is important that the medical assistant consistently adhere to these safety rules, which include the following. 1, perform all procedures involving blood or OPIM in a manner that minimizes splashing, spraying, spattering, and generation of droplets of these substances.
Very good. Natalie, will you go ahead and read number 2, please?
Observe warning labels on biohazard containers and appliances. Bags or containers that bear a biohazard warning label or are color-coded red indicated that they hold blood or open. Refrigerators, freezers, and other appliances that contain hazardous materials also must bear a biohazard warning label.
Very good. Talia, can you read number 3, please?
Okay. Bandage, cuts, and other, what's that, license on the hand before gloving, lations.
No. All right, very good. Thank you. Alicia, will you read number 4?
Sanitize the hands after removing gloves, regardless of whether the gloves are visibly contaminated.
Very good. Anastasia, can you read number 5?
If your hands or other skin surfaces come in contact with blood or open, thoroughly wash the area as soon as possible with soap and water.
Very good. Jasmine, number 6.
If your mucous membranes, example eyes, mouth, nose, come in contact with blood or OPIM, flush them with water as soon as possible.
Nancy, number 7.
Do not break or tear contaminated needles.
Very good. Natalie, number 8.
Do not remove, recap, or bend a contaminated needle. No, sterile needles may be recapped, such as after the withdrawal of medication from a vial or ampule.
Very good. Okay, so you will see when we're in the clinic what this means to recap when it comes time for us to draw up medication, whether as recapping after we did an injection on a patient. Okay. All right, very good. Talia, can you read number 9, please?
Immediately after use, place contaminated sharps in a puncture resistance, leak-proof container that is appropriately labeled or color coded. Contaminated sharps are contaminated with objects that can penetrate the skin, including but not limited to needleless lancets, scalpels, broken glass, and capillary tubes.
Very good. Thank you. Alicia, can you read number 10?
Do not eat, drink, smoke, apply cosmetics or lip balm or handle contact lenses in areas where you may be exposed to blood or OPIM.
Very good. Anastasia, can you go ahead and read number 11?
Do not store food or drinks in refrigerator, freezer, or cabinets or on the shelves or countertops where blood or OPIM are present.
Very good. Jasmine, if you'll read the next one.
Place blood specimens or OPIM in containers that prevent leakage during collection, handling, processing, storage, transport, or shipping. Ensure that the containers are closed before they are stored, transported, or shipped, and are labeled or color-coded for easy identification.
Very good. Nancy, go ahead and read the next one.
Before any equipment that might be contaminated is serviced or shipped for repair or cleaning, such as a centrifuge, it must be inspected for blood or OPIM. If such material is presented, the equipment must be decontaminated. If it cannot be decontaminated, it must be appropriately labeled to indicate clearly the contamination site to enable those coming into contact with the equipment to take appropriate precautions.
Very good. Natalie, go ahead and finish up for number 14, please.
If you are exposed to blood or open, perform first aid measures immediately. Wash a needle stick injury thoroughly with soap and water. After taking these measures, report the incident to your provider or employer as soon as possible so that the post-exposure procedures can be instituted. See the box OSHA post-exposure evaluation and follow-up procedures. The most obvious exposure incident is a needle stick, but any eye, mouth, or other mucous membrane, non-intact skin, or contact with blood or open constitutes an exposure incident and should be reported.
All right, very good. So you guys are going to want to highlight number 3, 4, 9, 10, and the first sentence on 14. All right, personal protective equipment. The OSHA standard specifies that personnel protective equipment must be used in the medical office whenever occupational exposure remains after engineering and work practice controls have been instituted. Personal protective equipment is clothing or equipment that protects an individual from contact with blood or OPIM. Examples are gloves, chin-length face shields, masks, protective eyewear, laboratory coats, and gowns. The type of protective equipment appropriate for a given task depends on the degree of the exposure that is anticipated as outlined here. You guys are going to want to highlight where it says underneath the figure 2.7, personal protective equipment, and the examples of that. Talia, will you please read number 1?
Wear gloves when it is reasonable, anticipated that your hands will have contact with blood and OPIM, mucous membranes, or non-tacted skin. When performing vascular access procedures and when handling or touching contaminated surface or items, gloves cannot prevent a needle stick or other sharp injuries. They can prevent a pathogen from entering the body through a break in the skin, such as a cut, an abrasion, a burn, or a rash.
Very good, thank you. You guys are going to want to highlight just that very first part on number 1 where it says wear gloves when it is reasonably anticipated that your hands will have contact with blood. All right, Alicia, will you go ahead and read number 2, please?
Wear chin-length face shields or masks in combination with eye protection devices whenever splashes, spray, splatter, or droplets of blood or OPIM may be generated. Posing a hazard sign through contact with the eyes or nose or mouth. Example, removing a stopper from a tube of blood, transferring serum from the whole blood. Figure 2.7.
Very good. Anastasia, will you go ahead and read number 3, please?
Wear appropriate protective clothing such as gowns, aprons, and laboratory coats when gross contamination can reasonably be anticipated during the performance of a task or procedure. Example, laboratory testing procedure. The type of protective clothing needed depends on the task and degree of exposure anticipated.
Very good. All right, Jasmine, personal protective equipment guidelines. Will you go ahead and read number 1?
Certain guidelines must be followed when using protective equipment. Number 1, protective equipment must not allow blood or OPIM to pass through or reach the skin, underlying garments, example scrubs, street clothes, undergarments, eyes, mouth, or other mucous membranes under normal conditions of use and for the duration of time the protective equipment is used.
Thank you. Nancy, will you read number 2?
The employer must provide appropriate personal protective equipment at no cost to the healthcare worker. The employer is responsible for ensuring that the equipment is available in appropriate sizes, is readily accessible, and is used correctly. In addition, the employer must ensure that the equipment is cleaned, laundered, repaired, replaced, or disposed of as necessary to ensure its effectiveness.
Very good. Natalie, number 3.
Alternatives must be provided for employees who are allergic to latex gloves. Examples of alternatives include non-latex gloves and powderless gloves.
Very good. Talia, number 4.
If gloves become contaminated, torn, or punctured, they must be replaced as soon as practical.
Thank you. All right, you're going to want to highlight number 4. Alicia, will you go ahead and read number 5?
All eye protection devices must have solid side shields. Chin-length face shields, goggles, and glasses with solid side shields are acceptable. Figure 2.8. Standard prescription glasses are unacceptable as eye protection.
Very good. Anastasia, number 6.
If a garment is penetrated by blood or OPIM, it must be removed as soon as possible and placed in an appropriate designated container for washing.
Very good. You guys are going to want to highlight number 6. Jasmine, can you read number 7, please?
All personal protective equipment must be removed before you leave the medical office.
Very good. Go ahead and highlight number 7. Nancy, number 8, please.
When protective equipment is removed, it must be placed in an appropriately designated area or container for storage, washing, decontamination, or disposal.
Very good. Natalie, number 9.
Utility gloves may be decontaminated and reused unless they are cracked, peeling, torn, or punctured, or no longer provide barrier protection.
Very good. All right, Talia, finish up with number 10, please.
If you believe that using protective equipment will prevent properly delivery of health care or would pose an increased hazard to your safety or that of a coworker is extenuating circumstances, you may temporarily and briefly decline its use. After such an incident, the circumstance must be investigated to determine whether the situation could be prevented in the future.
All right, very good. All right, any questions over that so far? All right, how's everybody doing? Does anybody need a break?
Okay.
Good. Okay, we're almost finished. Only a few more pages. Okay. Housekeeping. The OSHA standard requires that specific housekeeping procedures be followed to ensure that the work site is maintained in a clean and sanitary condition. The medical office must develop and implement a written schedule for cleaning and decontaminating each area where exposure occurs. The cleaning and decontamination method must be specified for each task and should be based on the type of surface to be cleaned, the type of soil present, and the task or procedures performed in that area. Housekeeping procedures include the following. Number 1, clean and decontaminate equipment and work surfaces after completing procedures that involve blood or OPIM. Cleaning is accomplished using plain soap and decontamination is performed using an appropriate disinfectant. Number 2, clean and decontaminate all equipment and work surfaces as soon as possible after exposure to blood or OPIM. For decontamination of blood spills, OSHA recommends the use of a 10% solution of sodium hydrochloride, household bleach, in water, 1 part bleach to 9 parts water. Number 3, inspect and decontaminate all reusable receptacles such as bins, pails, and cans on a regular basis. If contamination is visible, the item must be cleaned and decontaminated as soon as possible. Number 4, do not pick up broken, contaminated glassware with the hands, even if gloves are worn. Use mechanical means such as a brush and dustpan, tongs, and forceps. Number 5, protective coverings such as plastic wrap and aluminum foil may be used to cover work surfaces or equipment, but they must be removed or replaced if contamination occurs. Number 6, handle contaminated laundry as little as possible and with appropriate personal protective equipment. Place all contaminated laundry in leak-proof bags that are properly labeled or color-coded. Contaminated laundry must not be stored or rinsed at the medical office. Number 7, if the outside of the biohazard container becomes contaminated, it must be placed in a second suitable container. Number 8, biohazard sharp containers must be closable, puncture resistant, and leak proof. They must bear a biohazard warning label and must be color coded red to ensure identification of the contents as hazardous. To ensure effectiveness, the following guidelines must be observed. Locate the sharps container as close as possible to the area of use to avoid the hazard of transporting a contaminated needle through the workplace. Maintain sharps containers in an upright position to keep liquid and sharps inside. Do not reach into the sharps container with your hand. Replace sharp containers on a regular basis and do not allow them to overfill. It is recommended that sharps container be replaced when they are 3/4 full. All right, you guys are going to want to highlight number 8 where it says biohazard sharp containers in each of those bullet points. All right, case study number 2. Tracy Smith is pregnant and is at the medical office to have her blood drawn for a prenatal profile. Tracy says she has been reading information about the hepatitis B vaccine because she knows her baby will be given this vaccine soon after birth. She wants to know why it is recommended that the infant be immunized for hepatitis B. Tracy says that infants are not at risk for contracting hepatitis B because the way it is transmitted is mostly through sexual contact and illegal drug use. Okay, so let's start with the first part. What would you do?
I know in some doctors' offices, especially prenatal doctors' offices, that they have pamphlets on stuff like that. So would you just give her a brochure? And
Yeah, you could. You could, but we need to be able to have a conversation with our patient, right? So we could give her information on the hepatitis B vaccine to make sure she has all the appropriate reading material about it. But what's something else that we also could do? So giving her a brochure is one.
We could explain to her that since babies are very susceptible to getting any type of infection, that they should have it because they get sicker faster than anyone, honestly.
That's right. So they're very susceptible to anything, right? I mean, they're just so tiny. So that's right. So we're investing, she's investing in her child's future. And you can tell her that if her child was to become infected with hepatitis B, um, she that child has a higher risk of developing more chronic hepatitis in the future. So that's a part of why we would recommend her having her child immunized. Okay, very good. So now let's flip it around. What would we not do?
I actually have a question.
Uh-huh.
So, are we allowed to recommend that they should vaccinate their baby?
Yes, you can recommend that it is an investment in their child's health to get immunizations done.
Okay.
We cannot make her. We can
Okay.
only suggest. Um, for those who are wanting to work in pediatrics and even in some OBGYN offices, you will notice this more frequently than what you may have noticed 5 years ago. More people are hesitant on getting their children immunized for their own reasons. Now, as a medical assistant, what would we recommend by telling these patients?
We would just give them our opinion. We wouldn't try and just persuade them to get them vaccinated.
Right, right. So, we could give our own personal opinion. Like in my personal opinion, I recommend everybody get immunized on anything. Whether it's measles, mumps, and rubella, or it's a flu vaccine. But I can't make anybody. So if you come across that patient who's like, well, I just don't want to give my child immunized. I don't. I'm against it. Okay, not a problem. If you come into that situation, all you need to do is document it and have that conversation with your doctor. Let them know, hey, Mr. and Mrs. So-and-so does not want their child immunized. And then leave it in the doctor's hands on what that doctor wants to do for that patient. All right, very good. All right, so what would we not want to do?
We don't want to judge them for asking.
Correct. She has the right to ask. Everybody does. But we certainly don't want to discourage her from having her child, from her baby being immunized. We don't want to do that, but we do want to provide our patient with all the information to make that decision. And there's nothing wrong in giving our personal opinion, but it is just that. It is our personal opinion. All right, very good. Any questions about anything? All right, so now we are going to go on to our hepatitis B vaccination. The OSHA standard requires employers to offer the hepatitis B vaccination series free of charge to all medical office personnel who have occupational exposure. The vaccination must be offered within 10 working days of initial assignment to a position with occupational exposure, unless the following factors exist. Number one, the individual has previously received the hepatitis B vaccination series. Number two, antibody testing has revealed that the individual is immune to hepatitis B. Or number three, the vaccine is contradicted for medical reasons. You're going to want to highlight 1, 2, and 3. And highlight where it says the vaccination must be offered within 10 working days of initial assignment to a position with occupational exposure. Now, how many of you ladies have already had your hepatitis B vaccination series?
I have.
Yeah.
I have.
If you've not already, you will be asked once you receive, if not on your externship, or you receive your employer, the offer of employment. Generally now, though, we require it before you even attend medical assistant school. All right, very good. Medical office personnel who decline vaccination must sign a hepatitis B waiver form documenting refusal. You're going to want to highlight that. This form must be filed in the employee's OSHA record. Employees who decline vaccination may request the vaccination later. The employer must then provide it according to the aforementioned criteria. Regulated medical waste. Medical waste is generated in the medical office through the diagnosis, treatment, and immunization of patients. Some of the waste poses a threat to health and safety and is known as regulated medical waste, or RMW. The OSHA Bloodborne Pathogen Standard defines RMW as follows. You're going to want to highlight each of these bullet points. Any liquid or semi-liquid blood or OPIM, items contaminated with blood or OPIM that would release these substances in a liquid or semi-liquid state if compressed, items that are caked with dried blood or OPIM and are capable of releasing these materials during handling, contaminated sharps, pathologic or microbiologic waste that contain blood or OPIM. RMW must be discarded properly so as not to become a source of transfer of disease. According to the OSHA definition, a dressing saturated with blood is considered RMW and must be discarded in a biohazard bag. A bandage with a spot of blood is not considered RMW and can be discarded in a regular waste container. Box 2.2 gives the guidelines for discarding medical waste in the medical office. So basically that means that if I can squeeze the gauze and blood penetrates from it, it needs to go in a biohazard bag. If it is a Band-Aid with a tiny little drop of blood on it, and I'm not going to be able to squeeze that blood out, then it can be discarded in a regular trash can or trash bag. Does that kind of make sense on what they're saying? All right. Any questions on that? All right. Very good. Handling regulated medical waste. RMW must be handled carefully to prevent an exposure incident. The OSHA Bloodborne Pathogen Standard outlines specific actions to take when handling RMW as follows. Alicia, will you read number 1, please?
Separate regulated waste from the general refuse as its point of origin. Disposable items containing RMW should be placed directly into biohazard containers and should not be mixed with the regular trash.
Very good. Anastasia, will you read number 2, please?
Ensure that that biohazard containers are closable, leak-proof, and suitable, concentrated to contain the containers storing handling, storage, and transportation. These containers include biohazard bags and sharp containers.
Very good. Jasmine, will you read number 3, please?
To prevent spillage or protrusion of the contents, close and lock the lid of a sharps container before removing it from an examining room. Never open, empty, or clean a contaminated sharps container. If there is a chance of leakage from the sharps container, the medical assistant should place it in a second container that is closable, leak-proof, and appropriately labeled or color-coded.
Very good. Nancy, read number 4, please.
Securely close biohazard bags before removing them from and examining room. To provide additional protection, some medical offices double bag by placing the primary bag inside a second biohazard bag.
Very good. Natalie, number 5, please.
Transport full biohazard containers to a secured area away from the general public using personal protective equipment, for example, gloves.
Very good. You are going to want to highlight number 5. All right, disposable of regulated medical waste. Each state is responsible for developing policies for disposal of RMW. To avoid non-compliance, it is important that the medical assistant to know and understand the specific regulated waste policies and guidelines set forth in his or her state. Regulated waste policies and guidelines for each state can be found on the following website: www.envcap.org/state/rmw/rmwlocator.html. Most medical offices use a commercial medical waste service to dispose of RMW. This service is responsible for picking up and transporting the medical waste to a treatment facility for incineration to destroy pathogens and render them harmless. The waste can then be safely disposed in a sanitary landfill. Regulated waste treatment facilities must be licensed and hold permits issued by the Environmental Protection Agency, EPA, allowing them to dispose of the RMW. A series of steps must be followed for preparing and storing RMW for pickup by the service. Although these steps may vary slightly from state to state, general measures required by most states include the following. Talia, will you go and read number 1, please?
Place biohazard bags and sharps containing to a recapable receptacle. What's that? Receptacle?
Receptacle,
Receptacle provided by the Medical Waste Service. The receptacle is usually a cardboard box. The box should be securely sealed with packing tape, and a biohazard warning label must appear on 2 opposite sides of the box.
Very good. Alicia, will you read number 2?
Store the biohazard boxes in a locked room inside the facility or in a locked collection container outside for pickup by the Medical Waste Service. This step is aimed at preventing unauthorized access to items such as needles and syringes. The regulated waste storage area should be labeled with one of the following: authorized personnel only sign and an international biohazard symbol.
Very good. Anastasia, will you read number 3, please?
Many states require that a tracking record be completed when the waste is picked up by the Medical Waste Service. This form includes such information as the type and quantity of waste weighted in pounds and where it is being sent. The form must be signed by a representative of the Medical Waste Service and the medical office. After the waste has been destroyed at the regulation waste treatment facility, a record documenting its disposal is mailed to the medical office.
Very good. You are going to want to highlight the first and second sentence on number 3. All right, case study number 3. Giles Lee is 55 years old and is at the medical office. 30 years ago, he was in a serious car accident and had to have a blood transfusion. He says that he donated blood for the first time 2 months ago. Last week, he received a letter saying that his blood tested positive for hepatitis C and that he should see his provider. Giles says that he must have gotten hepatitis C from the blood transfusion he received when he was 25. He does not understand how that could have happened because the blood supply is tested for these types of diseases. Giles wants to know why he has not had any symptoms. He also wants to know if he can give hepatitis C to his wife. All right. So let's start with
Document. So let's start with document.
Yes, document. That's right. All right, so what else are we going to do?
I guess give them as much as information as we can as far as the hepatitis C.
Yes. Yep, that's an option.
Got his transfusion years ago. He is 55 years old, so maybe they didn't have the resources to, filter out the blood or be able to like test it for that stuff.
That is true. So it wasn't back until the early 90s when we started testing those who are doing blood transfusion. So for this patient's incident, it is possible that he did contract it because it wasn't tested back then. So let's ask this: is it possible for someone to have hepatitis C and never show any symptoms?
Yes.
That is correct. Yes, it is possible. Okay. So is it possible for someone to infect another person with hepatitis C?
I want to say yes,
It is.
or else there wouldn't be a shot for it.
Yes. Very good. Okay, so now based on that information, what do we not want to do?
Well, we don't want to get infected.
Well, that's definitely true. We do not. So this particular case study is very important because you are going to come in contact with patients who have this same scenario. You're even going to come in contact with patients who are HIV positive. So it is very important that as a medical assistant, you put that thinking cap on how you handle these situations because it can make or break that relationship with that patient. So as this patient's medical assistant, what do we not want to do?
Judge,
Yes, we do not judge.
we want to be empathetic with him.
That's right. That's right.
And
What else?
also
Go ahead.
explain to him that not everybody shows symptoms for those type of things. And
That's right. Mr. Lee, I'm sorry that you are, having to deal with this type of situation. It actually is possible for someone to have hepatitis C and not show any symptoms. Unfortunately, when you received your blood transfusion, the testing of the blood was not available then. So that could be why. Now, as this patient's medical assistant, what is the important thing that I do not want to do for this patient?
You don't want to die.
Say that again, Nancy.
You don't want to diagnose.
That's right. So I'm going to understand the concern my patient has, but I'm not going to say, okay, Mr. Lee, let me go ahead and document that you're hepatitis C positive because we still don't know that for certain. We have to bring the provider in and allow the provider the opportunity to run the appropriate test to confirm or deny.
So it's very important that we use the appropriate words.
That
Like
is
it's
correct.
possible.
That's
There
right.
is a possibility.
That's right. So as a medical assistant, I don't know if y'all have heard of this before, but it's not what you say, it's how you say it. You will go back to the saying 95% of the time as a medical assistant in certain situations. It's not what you say, it's how you say it. All right, very good, guys. All right, any questions?
No.
All right. So, blood-borne diseases. The biggest threat to healthcare workers, from occupational exposure are HBV, HCV, and HIV. Hepatitis is much easier to transmit than HIV. After a needle stick exposure to blood infected with HPV, healthcare workers who are not immune to hepatitis B have a 6 to 30% chance of developing the disease. You are going to want to highlight those two sentences. The risk of infection after needle stick exposure to blood infected with HCV is approximately 2%. After a needle stick exposure to HIV infected blood, a healthcare worker has a 0.3% chance of developing HIV. He or she has a 0.1% chance of developing HIV after a mucous membrane exposure of the eyes, nose, or mouth. Hepatitis B. Hepatitis B is an infection of the liver caused by HBV. The most common means of transmitting hepatitis B in the healthcare setting are blood and blood components such as serum and plasma. That paragraph needs to be highlighted. Healthcare workers are most likely to contract hepatitis B through needle sticks and cuts with contaminated sharps. The virus also is spread in the healthcare setting, but less effectively, through blood splashes to the eyes, mouth, and non-intact skin, and through bodily fluids such as semen and vaginal secretions. The number of healthcare workers who contract hepatitis B in the workplace has declined dramatically since the development of the OSHA standard and the hepatitis B vaccine. Statistics from the CDC show that in 1983, there were approximately 17,000 healthcare workers who contracted hepatitis B in the workplace. But by 2001, that number had decreased by 95% to fewer than 400 healthcare workers. Post-exposure. Go ahead.
Okay, so HBV stands for hepatitis B vaccine.
That's right.
Okay, so why does it say hepatitis B is an infection of the liver caused by HBV? It's the
Because
same
it also means hepatitis B virus.
virus. Okay.
Yeah. So these are one instance where it's the same abbreviation, but it could mean two different things.
Got it. Okay.
Yeah.
Thank you.
You're welcome. All right. Post-exposure prophylaxis. Post-exposure prophylaxis, PEP, refers to treatment administered to an individual after exposure to an infectious disease to prevent the disease. That sentence needs to be highlighted. PEP for unvaccinated individuals exposed to hepatitis B involves the administration of a passive and an active immunizing agent. It is important to administer both of these agents as soon as possible after an exposure incident, preferably within 24 hours, but no later than 7 days. The passive immunizing agent provides temporary immunity to hepatitis B, giving the active agent a chance to take effect. The passive agent is a hepatitis B immune globulin, HBIG, which contains antibodies that provide immunity to hepatitis B for 1 to 3 months. The active immunizing agent in the hepatitis B vaccine is produced from genetically altered yeast cells. Brand names are Recombivax HB and Ingerix B. The hepatitis B vaccine is administered intramuscularly in a series of 3 doses. That needs to be highlighted. The second dose is given 1 month after the first dose, and the third dose is administered 6 months after the first dose. Highlight the next. For example, 0, 1 month, and 6 months. Highlight mild side effects include such as soreness at the injection site may occur, but serious reactions to the vaccine are extremely rare. As previously discussed, the OSHA standard recommends that all healthcare workers receive the hepatitis B vaccine, an active immunizing agent, as a preventative measure against hepatitis B. After an exposure incident, a medical assistant who previously had been vaccinated probably would not require further treatment. Hepatitis C. Hepatitis C is an infection of the liver caused by HCV. Currently, no vaccine is available for the prevention of hepatitis C. In the medical office, the most likely means of contracting hepatitis C is through peritoneal exposure to contaminated blood, such as through needle sticks and other sharp injuries. The chance of contracting hepatitis C in the healthcare setting is much lower than that of contracting hepatitis B. Most individuals with acute hepatitis C have no symptoms. If symptoms do occur, they are mild and flu-like. Approximately 70 to 85% of individuals with acute hepatitis C develop chronic hepatitis C. After 10 to 30 years, about 20% of these individuals develop serious liver disease, including cirrhosis of the liver and cancer of the liver. Ultimately, 1 to 5% of individuals with chronic hepatitis C die from liver failure. See the box highlight on viral hepatitis. Antiviral drugs have been developed to treat chronic hepatitis C and are effective in 40% of cases. All right, so this is some of the fun stuff. Does anybody have any questions about this so far? All right. Acquired immunodeficiency syndrome, AIDS, is a chronic disorder of the immune system that eventually destroys the body's ability to fight off infection. Highlight: AIDS is caused by a retrovirus known as the human immunodeficiency virus, HIV. All right, really quickly on page 47, under the highlight on viral hepatitis, under hepatitis C, in the first paragraph, you need to highlight the last two words, liver cancer. And in the next paragraph, you need to highlight the first sentence where it says the most common means of transmission of hepatitis C is sharing needles for injection drug use with an infected individual. All right, the following description helps to clarify the difference between these two terms on page 48. The virus and the infection itself are known as HIV, whereas the term AIDS is used to refer to the last stage of HIV infection. Simply put, the terms HIV infection and AIDS refer to different stages of the same disease. When HIV gains entrance into the body, it begins to attack and destroy certain white blood cells known as CD4 T cells, which are involved in protecting the body against viral, fungal, and protozoal infection. As more and more CD4 T cells are destroyed, the immune system is gradually weakened. After a period of time, which may last 10 years or longer, the body's immune system becomes so ravaged by the attack that it succumbs to the disease associated with AIDS. AIDS is characterized by the presence of severe and life-threatening opportunistic infections and unusual cancers that rarely affect individuals with healthy immune systems. An opportunistic infection is an infection that results from a defective immune system that cannot defend itself from pathogens normally found in the environment. That needs to be highlighted. Opportunistic infections are extremely difficult to treat because the infection tends to recur quickly after course of therapy is completed. Transmission of AIDS. Research has shown that HIV is not transmitted through casual contact or even extensive contact, such as occurs among family members of AIDS patients. That needs to be highlighted. In the general population, HIV is spread primarily through sexual contact with an infected person by sharing drug injection needles with someone who is infected. And by sharing. Untreated HIV-infected women also can transmit the virus to their infants during pregnancy and birth and through their breast milk. Because HIV is not easily transmitted, the risk to healthcare workers is low. Since reporting began in 1985, the CDC had received reports of 58 documented cases and 150 possible cases of HIV infection in the healthcare workers caused by occupational exposure. Despite the low risk of infection, however, the serious nature of HIV infection warrants the use of the OSHA bloodborne pathogen standard by all healthcare workers. Because most HIV carriers are asymptomatic and may be unaware of their infection, precautions minimizing the risk of exposure to blood and bodily fluids should be taken with all patients at all times. These precautions are also recommended as means of protection against other bloodborne pathogens such as hepatitis B, hepatitis C, and syphilis. All right. So any questions about that?
No.
Okay. So in my 20 years, I have come in contact with several HIV and AIDS positive patients. As a medical assistant, you will not treat these patients any differently. You are just aware of your surroundings. When I call a patient back who has notated on their chart that they are HIV positive, I don't say anything. I perform my job as normal. I do let my doctor know that the patient is HIV positive, whether it's in words or I show them the documentation on their chart. That is it. You perform your job as normal. So it basically all boils down to you become aware of your surroundings. You are always cleaning after the patient, using gloves, performing procedures properly. That doesn't change whether a patient is HIV positive, AIDS, hepatitis C, syphilis, or not. It doesn't change. If you start implementing the safety from the very first day, you will not treat your patients any different whether they are positive or they are not. But you will never treat your patients any different as well. Any questions on that? All right. So that is it for chapter 2. So I do recommend that you read all of the highlights, the box 2.2, box 2.1, the figures, the procedures, and the terminology in the chapter. You are responsible. Let's see. Nancy, will you please tell me what it shows on today for Evolve on the calendar?
All righty. Today's Wednesday, correct?
Yes, ma'am, it is.
Alrighty. It shows chapter 1 test due by the end of the day today. Chapter 2 video evaluation due by the end of the day. Chapter 2 apply your knowledge due by the end of the day. Grade chapter 1 study guide questions. Homework chapter 2 study guide pages 33 through 41 odds only due by 6/18/2020. Read chapter 3 and review chapter 3 YouTube.
Very good. Okay. So today's agenda is going to be after starting today and going forward, kind of how we're going to be doing it. So you need to make sure you do your review, your chapter 1 test. You'll do the chapter 2 assignments and evolve. You will do the chapter 2 study guide questions, and then we will grade that tomorrow morning at our 8:30 lecture time. Any questions about anything?
So where do we find the chapter 1 test? Because I know there's links for the apply your knowledge and the video evaluation, but not for the test.
Okay, so there should be.
It says apply your knowledge chapter 2, video evaluation quiz chapter 2, and test bank chapter 1.
There you go. So the test bank is the chapter 1 test.
So where do you find that? That's what I'm saying. There's not a link to that one.
There should be on your calendar.
Okay.
All right, hold on a second.
You should just be able to click on the test bank, the little orange box.
Right, it should be allowing you to.
And it should just take you to it.
Right, so hold on a second. Let me make sure that that's what's going on. Does anybody else not see chapter 1 test bank?
When you click on it, when I click on it, it goes to begin assessment.
Okay. Good. All right, so let me just make sure that it's opened up for everybody. And we will be done for the day. Okay. Go back to the calendar and see if you see it now.
If I don't see it, can I just message you just because I have it downloaded on my computer, and if I get out of here, it's going to leave me, like, I'm going to have to leave the chat. You know what I mean?
Yes, yeah, and that's fine. And you guys will probably notice that too. If we're using WebEx and we go into Evolve, for whatever reason, it slows Evolve down. And sometimes the calendar will take a minute to load. So that's not a problem at all. If you notice that you don't see the link, just message me and I'll go in and I'll take a look at it.
Okay.
All right. So if you've not already done so, and Alicia, I already know you're going to submit me your study guide deal later today. But
When will that video be up? So that way I can grade it after I find the answers and stuff.
That's fine. Yeah, that's fine. Just let me know.
Do you know when this video will be up?
So yesterday's video, It took me about 3 hours before I could load the video. It took forever.
Okay.
So I'm gonna say hopefully by later today, and I
Okay.
will let you know. I'll send out a thing like I did yesterday to let you know that
Okay, and then
it's loaded.
I'll do it after that. Okay.
Okay.
Cool.
All right, that's fine. Okay,
Thank you.
so otherwise, you're very welcome. Otherwise, if you've not already done so, just go ahead and send me a message on how many the answers that you missed, and then I will log in your grades. And then if you have any questions, let me know. And that's it. As long as everybody's good, then we'll go ahead and stop for the day.
Are you gonna be sending us our grade?
Oh,
One more time.
I said, will you be sending us our grade for
Yes.
our? Okay.
So for those of you who've already let me know on how many you missed, you can go to your Evolve grades here in just a few moments, and you'll be able to see the grade you made. If for whatever reason you don't see it, not a problem. I'll let you know what the grade is.
okay. So we're just gonna send it to your email on how many we missed.
Yes, or you can do it through Remind or even a text message is fine.
Okay.
Yeah, I just need to know how many you missed. All right. Any other questions?
Nope. All right.
Okay.
Thank you.
All right. You're welcome. You guys have a good day, and I will see y'all, if not this afternoon, tomorrow morning.
All right. Bye.
Thank you.
You're welcome.